It is a really rough time to be a dental associate right now. Currently, there's about 7,000 dental students graduating just this month that are planning on entering the workforce. Yet, according to the BLS, there's only about 4,900 jobs expected to open over the next year. So that means there are more dentists that are entering the market than there are jobs available. This problem has been compounding over the last few years, and it just keeps getting worse and worse. I saw a statistic that basically for the last 10 years, there's been a new dental school opened every year in the US. And I think there's 4 right now that are not yet open that are going to be open soon. There was a school not that far away from where I live in Tennessee, that just recently opened a few years ago. And I'm just now starting to talk to some of the people who are getting close to graduating from that school. I also got an email from someone, it was either this week or last week, who was telling me they are in Turkey and they're planning on moving to the US. And usually you would think, okay, well, they're in another country, they're moving to the US, they're gonna have to go back to dental school, or at least do one of those 2-year accelerated programs in order to get their license. He said that the school is CODA accredited, and when he graduates in Turkey, he's gonna be able to move to the US and just apply as if he went to a normal US dental school. I mean, he still has to pass the US boards and everything, but he doesn't have to go back to school. He can just move to the US and get a job. The number of dentists looking for jobs is growing faster than the number of jobs that are available. So what does this actually mean if you are one of these dentists that is about to graduate that is looking for a job? Just 8 or 10 years ago, it was common knowledge and it was expected that when you got an associate job, you were going to be earning 35% of your production. This was just the standard number that was expected. 35% is what you earned. When I first graduated and I was looking at associate jobs, the trick that a lot of the companies and dentists were doing is, yeah, they still had to offer you the 35% because that was just what the standard was at the time. But they were trying to pull this trick where instead of offering you 35% of your production, they would offer you 35% of your collections, which collections are always going to be a little bit lower than production. Depending on the office that you work at, that number might be relatively close or it might be relatively far. Sometimes collections can be, maybe just 90% of production. And oftentimes when you use production in this circumstance, you're talking about adjusted production, which basically means you're taking into account the insurance write-offs. Obviously, you're not going to be paid 35% of the production before insurance write-offs. But adjusted production, it was common. You get 35% of adjusted production. And by offering 35% of collections instead of production, you were effectively earning more like maybe 33% of production. And so of course what I did when I had the opportunity to work a job where they wanted to pay me 35% of collections, I said, hey, in order to take that into account, let's make it 38%, 37, 39, maybe 40% in order to account for that collections number. The problem is today I'm seeing dentists accept offers significantly below that 35% of production number. I get it. You look for jobs and that's just what they're offering you and you don't know what else to do. You need a job and everyone says, hey, we're only going to pay you 32, 30, 28% of collections. That's really bad. If you are working as a dentist and you're making less than 30% of collections, it's honestly pathetic. It's sad. I feel for you. It's a rough time to be an associate because there are more associates entering the market. It's more competitive for these jobs. And so sometimes you have to take these jobs that are paying less. And every single year I have been seeing this number go lower and lower and lower. Just today I had a phone call with a client and he was telling me he has a friend who just accepted an offer for 23% of her collections. I wouldn't even get out of bed for 23% of my collections. Do you understand that when you are a practice owner, you can sometimes make as much as 100% of your collections if you have your office run properly? And basically every owner, even if they're not working that hard to run their office well, they're going to be keeping at least 50 to 60% of their own collections. The reason is because you can take into account what the hygienist is doing at the office. The hygienist is going to be helping you cover the overhead at that office. So even if you're running at a 60% overhead with a 40% profit margin for the entire office, because you have a hygiene team and maybe you have an associate working there, you can actually be making a much, much, much higher percentage of your collections. And to make the matters worse, dentists are taking longer and longer to build up the courage to go out and buy or start their own dental practice. It used to be that every dentist, when they graduated from school, they became practice owners. That's just how it was. And then 60, 70 years ago, associate jobs started becoming a thing. And there were, 50% of dentists would work as an associate for a little while. The majority would still own their own practice right out of school. But that was a different time. Today, it does make sense to work as an associate at least for a little while, maybe a year out of school. But after that, you're ready to be an owner. And anytime you spend working as an associate after that initial year out of school is really just wasted time and wasted money. For whatever reason, dentists are afraid today, and they're not taking that step into ownership. Even in just 2025, 32.5%, about a third of dentists who are under 30 own their own practice. Today, that number is down to 8.8%. Overall ownership rates used to be about 85%, and now they're down to about 70%. Which means 30% of dentists working right now are working as associates. 70% are still owners. The majority of dentists are still going to be owners because it's just so obvious that you're going to become an owner, because you can make twice as much money as an owner while working the same amount of time that you will be working as an associate. And that's if you accept a normal associate salary of 35% of your collections. If you're accepting 23% of your collections, you could be making three times as much if you were working as an owner rather than an associate. The thing is though, that 70% of ownership is mostly older dentists. The younger dentists, they're the ones that are making up that 30% associate. If you go to an Aspen Dental or a Heartland Dental or a Pacific Dental or some sort of DSO, local regional DSO, whatever, chances are the dentist you're seeing is going to be below 35 years old. If you're 40, 45, 50 years old, you've been working in dentistry for 15 years, you're not gonna work for Aspen, you're not gonna work for Heartland, you're too smart for that. It's the young, inexperienced dentists who are afraid that are taking those jobs, and they are getting taken advantage of. If you are working for 23% of your collections, there's no other way to put it other than you are getting taken advantage of. I have a business where I help dentists buy dental practices, and as a result, I have a lot of phone calls and a lot of emails and a lot of conversations with young dentists, and I've been hearing about the types of offers they're getting for associate positions and the types of jobs they're taking and the types of jobs they're hearing their friends taking, and these jobs keep getting worse and worse and worse each year. So if you're in this kind of situation, what are you gonna do? That's what I wanna talk about next. I wanna talk about what do you do if you are an associate and you are looking for a job, you're graduated from school, you know you have to take an associate job, at least for a year. What do you do? First off, if you can help it, try to live somewhere where there are fewer dentists. If you're trying to live in San Francisco, in New York City, in Seattle, if you're trying to live in one of the top 20 cities in the US, these big metropolises, you're gonna have more competition and it's gonna be harder to find a higher paying job. I'm not saying you have to live there forever, but if you're trying to find a better job, that's gonna help. Now, with that being said, there are a lot of potential opportunities even in the big cities, and you still can find good jobs, but it's going to be easier if you go to a smaller city. Usually a suburban type area is going to be your best bet. Rural areas, yeah, there's less competition out there, but there's also less patience. If you go to a big city, there's a lot of patience, but there's a lot of competition. If you can find a mid-size type city, that's where you might be able to find the optimal ratio of lots of patience available, but not as much competition. Now, once you've decided where you want to live, the next step is going to be applying for jobs. I get emails from dentists who are in like D2, D3 year D4 year, and they're saying, hey, I'm already looking for a job and I need some advice. If you're still in dental school, don't look for a job. I don't care if you're in your second semester of D4 year. It's not time to find a job yet. You want to get out of school and get your license first before you apply for a job. Trying to apply for a job months out is just a waste of your time. The reason is, the best job for you to find is going to be a job where there was a dentist there before you who is now leaving, and you're going to fill in that position. In order to find a job like that, most dentists are only going to give about a month's notice, if even that, before they leave. And so you are not going to be able to find a job like that until you're about a month out from being able to work at that office. If you apply for some job 6 months out, sure, they would be happy to have you, because that means you're going to be coming to an office where there's already a dentist there, and you're not going to have any patients, which means you're going to come in and you're going to have to see new patients, and you're going to have to build up your schedule over time, meaning you're not going to have very much work on your schedule at first, and you are going to be building up the business for the owner of that practice. The more patients that are being seen at an office and the more production that it is doing each year makes that practice more valuable to the owner of the practice. And so, in addition to the money that they are going to be making by having you at the office, you are also building up their equity in the business. And so, of course, if you call them 6 months out and say, hey, I'm looking for the job, they're gonna be so excited. Like, oh, Dr. Smith, Dr. whatever, we have a perfect position for you. Yeah, absolutely, because you're gonna be going there, getting taken advantage of, taking this job where you don't have a full schedule so that you can build up their business. And by the time you've been there for a year or two and you realize you only made $120, $150, $180, $200,000 that year, when you could have been at another job where you were making $300,000, $400,000 that year, or you could have been an owner and been making $500,000, $600,000, $700,000 per year. By the time you realize it, you've already been at that business for 2 years, and you have built an enormous amount of value up for the owner of that business that you are in no way going to get to keep for yourself. Your goal when you find an associate job should be to find the job where you are going to be the most busy, where you are going to have the highest number of patients to see, and you are going to have the lowest amount of competition from other dentists in that office trying to take procedures from you. The absolute worst type of job to have is if you go to an office where there is an established dentist who has been there for a long time, maybe an owner, and you're working as an associate. If you get into a situation like that, you're going to be in a situation where the owner is going to take a lot of the high dollar procedures. If a patient comes in and says, hey, I have all these crowns that need done, guess whose schedule that's going on? The owner. Guess whose schedule the patient who needs implants is going to go on? Guess whose patient, the patients that are going to be profitable, they're going to be seen by the owner. And then guess what? An 8-year-old comes in who maybe has a filling to do. Guess whose schedule that's going on? The associates. Yeah, associate, you can go do that filling on that 8-year-old, and I'll go do these 7 crowns on the 78-year-old. Well, that seems fair, right? No, that is not fair. That is how you get taken advantage of. When you are a dentist, you are agreeing that you are going to see multiple different types of patients, and some of them are a lot more profitable, and some of them are a lot less profitable. And that's just kind of the agreement that you sign up for being a dentist. You agree some of your patients are going to be more profitable than others. That's just how life works. But if you take an associate job where the owner's plan is for you to do those lower margin procedures and he or she does the higher margin procedures, you're just setting yourself up to just be in a very bad situation where you're not making much. You're working your butt off. Your back is going to hurt from bending over and doing all those fillings on 8-year-olds. It's just not worth it. Probably for your first job, you're going to be working at a corporate office. There's nothing wrong with working at corporate for a year or two, as long as you understand what you're trying to do at that associate job. Your goal at that associate job is not to buy into the practice later. Just stop thinking that you're going to find a job that you're later able to buy into. It almost never works out. Almost never. Occasionally it does, but it's just not worth the risk. There are so many things that could go wrong with that type of situation. For one, oftentimes these types of buy-in positions are really just an attempt that the owner is putting out there. Maybe I'll let you buy in one day. They're doing it because they're trying to get you to work there as an associate. And it's probably not a very good associate job. They're probably paying you a lot less than they would be paying you if you were at a better job. But the reason they're able to get you there is because they're stringing you along with the idea that maybe one day you'll be able to buy into the practice. Oftentimes dentists will act like they want to retire at a certain time. They say, hey, I'm planning on retiring in 1 to 2 years, and if you come over and work for me, I'll sell you my practice in 2 years. But what happens, this dentist was unhappy at their job because they were there by themselves, they were working super hard, they were getting tired of it, and they weren't making as much money as they wanted to. But then you come in, you work as an associate for this dentist, and now, guess what? This dentist is now making a lot more money, and they're working a lot less hard because you are there, you're doing the low margin procedures. The dentist, who's the owner of the practice, is getting to do those high value procedures, and now he or she is making maybe twice what they were making before you got there, and you are just bringing them so much money in, easy money for them, that they no longer want to retire. Why would they want to retire when they have an associate who is giving away a portion of their production to the owner? When you work as an associate, you are giving a portion of all of the work that you do to the owner of that business. And so this owner, who before had to produce the entire production by him or herself, now is able to work even less than before and make more money. And so now they don't want to retire as soon as they originally wanted to retire. Now, instead of retiring in 1 to 2 years, now they're saying, well, maybe 3 to 4 years. Then you get there, well, maybe 5 or 6 years. It's not uncommon for dentists to work until they're 90 plus years old. I see it all the time. Just because you find a dentist in their 60s does not mean they're going to be retiring soon. They could still be another 10 years out from retirement. The other problem with this is if you go and work as an associate, you are going to be raising the value of that practice. The value of a practice is determined by the amount of production that was done in the previous years. So if you come in and increase the amount of production that was done at the office, now the practice is going to be more expensive to buy. It's going to be worth more money. And so this dentist could sell their practice for more now that you have worked there and helped them build it up. If you were doing a good job at your associate position, you probably brought patients into this practice. You probably did work on patients and they liked you, and now they're coming back to the practice because of you. You have literally increased the value of this practice. And now if you want to buy the practice, maybe this practice before would have cost you $300,000, $400,000 to buy. But because you worked there for 2 to 3 years to build it up before you buy into the practice, now you're buying a practice that might cost $700,000, $800,000, $1 million, $1.3 million. I've seen practices sell for as much as $2 to $3 million. You basically just worked at this office for free for 3 years because all of the work that you did grew this practice up, and now you're going to buy the practice back. You're going to be buying back the value that you just added. Not only did you work for 3 years, making half of what you could have made if you were working as your own boss, you were also going to be buying into the practice from this dentist that just took advantage of you for the last 3 years. Yeah, this is an amazing deal for the seller. This is an amazing deal for the owner of that practice, but it's an absolutely terrible, terrible, terrible deal for you as the buyer. So what's the answer? What is the answer then? It's really simple. It's really not that complicated. Because it's more competitive to be an associate right now, you should spend less time working as an associate, and you should focus on trying to become an owner as quick as you possibly can. understand that because fewer and fewer dentists are trying to become owners right now, it's less competitive for you to find a practice to buy. It's just supply and demand. If associate jobs are becoming more competitive and buying a practice is becoming less competitive, which one should you do? Now, you might be asking the question, is buying a practice becoming less competitive because it's not as profitable? Maybe buying a practice isn't worth it. Maybe it's a bad deal to buy a practice. It can be. It can be a bad idea to buy a dental practice. If you don't buy the right practice, if you don't know what you're getting into, you could buy a bad practice. I have now heard from quite a few dentists who have gone out into ownership because they thought, I'm gonna be making so much more money when I become an owner. I'm gonna buy this practice, and they don't even do their due diligence. They don't hire a professional to help them properly evaluate the practice. They don't have any friends that they can talk to actually ask who have experience doing this themselves. If you buy the wrong dental practice, you could be in a situation where you are making less than you were making at your associate job, and you now have to pay back a practice loan in addition to making less, and you can really get yourself into a pretty terrible situation. And right there, that's the main reason that fewer and fewer dentists are becoming owners right now, especially the young dentists. They don't want to become owners because it's risky and they don't understand the numbers behind the business. They don't know what they're getting into. The associate jobs, especially the bigger DSOs, they understand this, and they are trying actively to make it more and more difficult for you as the dentist to learn the business, to understand how things are working in the front office. They try to keep you in the back, away from the front office, so you don't understand what's going on. They don't want you to understand how to run they don't want you to understand how to run your own business, because their profit is made by you staying and working there at that office as an associate. If, however, you figure out what you're looking for in a practice, if you can learn enough about dental practice business operations to understand what a practice is worth, then if you look hard enough, there are a ton of amazing opportunities out right now. I've helped some clients go from making $200,000 to $300,000 a year as an associate to making $600,000 to $700,000 their first year of ownership. And that's not taking into account the fact that they're also building equity in a business, and it's not taking into account that if they're buying the real estate, they're also building equity in the real estate of that practice. Now, not everyone is gonna make $700,000 their first year of ownership, but it's definitely realistic. I know multiple dentists making more than $1 million as owners. A good goal to aim for is probably making at least $300,000 to $500,000 in your first year of ownership. That's totally realistic. It would not be that difficult to hit somewhere in the $300,000 to $500,000 your first year of ownership. If you are willing to work a little bit harder, maybe you bring in some new procedures. You find a practice that wasn't placing implants. You find a practice that wasn't overproducing on patients. You come in, you're placing implants now. You're now doing a lot more crowns than the seller was doing. You might double production in your first year. And if you can double production without dramatically increasing the expenses that you have, which is usually pretty easy to do if you find a practice that's a little bit older and the dentist maybe had too many staff for the amount of work he was doing, it's easy to come in and really grow those types of practices. You can make a lot of money. So I don't want to be too discouraging here. Is it a good time to be a dental associate? No, it's really not. It's a really bad time. It's becoming more and more competitive. It's really a terrible time to be a dental associate. But is it a good time to be a practice owner? And the answer is, if you buy the right practice, it has never been a better time to be a practice owner. It is such an amazing market out there right now. There is so much opportunity. Don't just buy the first practice you find. You're going to talk to some practice brokers, and they're going to send you some practices that they've had on the market for a long time. When you first reach out to those brokers, they're trying to get rid of these practices they have. But if you stick with it, if you wait out a few months and you keep looking, eventually you're going to find some really amazing practices. Work for a year as an associate. Find a busy associate job for a year, negotiate as much as you can, try to negotiate that salary up, but it is what it is. If you're not making that much, you're not making that much. It's fine, because you're gonna be an owner and you're gonna be making so much more money. Just make sure that you don't sign any contracts that are going to prevent you from becoming an owner. Do not sign a non-compete agreement. Just don't do it. You don't have to do it. There are so many jobs out there that don't require non-compete agreements. And even the ones that initially try to get you to sign a non-compete, just say, hey, I don't want to sign that. And they're probably eventually going to be like, okay, fine, you don't have to sign it. Don't sign a non-compete. Don't sign any type of contract where you agree to pay them a certain amount if you leave before a certain date. There's just no reason to do that. It's not worth your time. There are plenty of jobs out there where you don't have to agree to some certain amount of time or pay some sort of early termination fee. Just stay away from that kind of stuff. Don't sign it. Your time is way too valuable for that. You went to dental school. Your ability to produce on patients is basically like no other skill anyone else has in the entire United States. Maybe if you're like a brain surgeon of some kind, maybe some sort of cardiac surgeon, yeah, maybe then your time is a little bit more valuable than being a dentist, but dentistry is one of the most profitable skills you can have. You need to take advantage of that. Understand that these associate jobs that you are applying for, they are trying so hard to fill those positions with dentists. Their entire business is predicated upon dentists being willing to sign up and work at their offices. You have the negotiating power here. Even though it feels like maybe competition is high and you don't have that negotiating power, the reality is you actually do have a lot more negotiating power than you think. Just the other day, talking to a dentist, he negotiated his daily minimum up from $1,500 per day to $2,500 per day. Another dentist I was talking to negotiated his percentage up from 30% to 37%. Now it was 37% of collections, which isn't as good as production, but 37% of collections is probably somewhat similar to 35% of production. So hey, I mean, it's not great, but it's better than 30%. You have negotiating power. You need to just do the best you can for the first year and then buy a practice. That's really what it comes down to. And make sure you buy the right practice, because I have had some dentists tell me they bought a practice, didn't do well. It's because they bought the wrong practice. Okay.